Bismillahirrahmanirrahim. We are looking at the serology of hepatitis B. In the viral hepatitis, especially hepatitis A, B, C, D, E. So the serology of hepatitis B somehow looks tricky, but after this short tutorial, you will become easier to attempt any question related to the serology of hepatitis B. So first of all, you should be able to appreciate the three antigen and three antibodies associated with the hepatitis B virus. So mnemonic is a second or SEC. So these are three actually antigen. So we are coming back. First of all, what is antigen? Antigen actually it's coming from the virus, so which attack the immunity. Okay, so in response to that, the human body the immunity activate and they form the antibodies. So the antigen are present in in the viral structure, and the antibodies are produced by the human, which provide immunity. So what are the three main antigen? Okay, so this is size of actually the HBV. Okay, so this is the nucleus, or you can say the DNA, which is partially double stranded DNA. Here is DNA polymerase. So the number one antigen is the surface antigen. Okay, HBS antigen, and against this the antibody will be the anti-HBs. Okay, so first is the second surface antigen. Okay, the second one is the between the capsid and this envelope. So this is the E antigen, HBE antigen. So the antibody against it will be the anti-HBE antibodies. Okay, so SE. The last one is C, that is the capsid or core antigen. Okay, so HBC antigen, the antibody by the human will be the anti-HBC antibodies. So core antigen, core antibody. So second, I mean the antigen HBS, HBE, HBC. Okay, so this the anti HBC is either IgM or which is in the acute infection. You know better. First of all, the our immunity start with the IgM, then later become IgG. So in the chronic infection, so you will see the IgG, while in the acute infection you will find the IgM. So these are, and this is actually these are anti-HBC, both IgM and the IgG. Okay, so three antigen, three antibodies. So let's look at this mnemonic to pick up the MCQs easily. Okay, so mnemonic is same score. S represent the HBS, A represent acute, M represent IgM, and E represent HBE. Okay, so in the acute infection, you will see the HBS is positive, IgM is positive, HBE is positive. Okay, and you know better when the infection become chronic, IgM become IgG. Okay, so in the chronic phase, you will see the S is positive, M is positive, E is positive, and the IgM replaced by IgG. In the acute, you will see the same. Same is mnemonic. So in the A, mean these SME are positive. Okay. So you know better HBS, S represents sick. So if anti-HBS is present, mean patient is not sick. It mean he is immune, or you can say that he is vaccinated. So if only anti-HBS is positive, mean patient is vaccinated. Okay. Okay. So and the same me, which they represent me, which show the window period, which I have already described you. So this was the window period where HBS level was low. Only IgM and HBE are for the me. That is the mnemonic here. Okay. So me mean M. If you rotate the M, it's become W. So mean window period. Me show them. So in the window period, what you will see? You will see the IgM is positive and anti-HB is positive. Okay. What about the recovery phase? Recovery phase. Remember the score S. I mean, in the recovery, you will every antibody you will see the anti-HBS, anti-HBC, R represent the recovery phase, E represent the NTHB. So SCRE, R represent recovery, and these SCE represent your antibodies. Okay, so in the MCQ, in the especially in the USMLE or in the step one exam of LM, so they use the term recovery, the past infection, immune due to natural infection. These three terms are same. So recovery or past infection or immune due to natural infection. So the serology will be same in this case. Okay. So, as I mentioned, the antigens show the attack immunity, antibodies and describe the provide immunity. So, if all the tests are negative, mean what? There's no exposure to virus and there is no immunity. Mean there he is not vaccinated. He has not yet he has not yet exposed to virus and he has not the immunity at this time, so the patient is susceptible. Okay, so this is acute same, so this is mnemonic same for acute, and IgG in the chronic phase. If the anti-sick mean vaccine, and for the score, so recovery, and window me IgM and anti-HB. So you can pick up the a lot of MCQs through this mnemonic. Let's look at some MCQs point. So in the MCQ you will see in the case scenario three tests mainly: HBS, anti-HBS, anti-HBC. By looking at these three tests, you can define what is the phase of the infection. This is all about the serology of hepatitis B virus. Thank you very much. Allah Hafiz.